Hello everyone, my name is Dr. Aditya Gupta. I am currently doing my DM in Pediatric Oncology from AIMS New Delhi after finishing my MD in Pediatrics from the same institute. In this video, I'll be talking about how do you decide upon your college as far as NEET PG counseling is concerned. I've done a lot of videos about how to choose your branch if you're having some doubts regarding the pros and cons of the branch that is particularly concerned. But in this video, I'm going to talk about if you have decided upon your branch, how do you decide upon your college? So, in my opinion, and I can be wrong, definitely, but do listen to me, do listen to my arguments that I'm going to put. The first and the foremost thing that decides your college is bond. I don't mean to be rude to anyone, but this is, in my opinion, the biggest and the most important factor that should decide your college. If any state has a bond that can impede your growth, if any state has a bond that can impede your progress as a doctor, then that college is not worth it. I have a post from Facebook from someone who said that he had got a 1500 rank in NEET PG last year. Sorry, in 2018. He just completed it, but he joined surgery, his passionate branch. He joined it, in fact, in the best college of his state. Despite that, he said he suffered because of the bond. He won't be able to pursue an MCH because of the bond. He won't be able to. He has to serve that bond before he's able to even think about going to another state. Even for, let's say, a simple SR-ship, even for becoming a senior resident, he now has to complete a bond in the same state. And he suffered from a low stipend. Now, I don't know why people believe that if someone says, I'll be very blunt with you. If someone tells you that in 3 years, you'll become good at the branch that you're doing, until and unless it's radiology and dermatology, again, exceptions are there, they're lying. Medical field, it's too vast to become good at in 3 years. It's absolutely 100% impossible, and I can be very sure about this. You cannot become excellent at a branch in 3 years. Medical field is too vast. You need more experience. And in order to gain that experience, that will be holded back by if you're doing in a college that has bond. You will be bonded to that state. You won't be able to explore your options. If you're doing in a field that requires DM, if you're doing in a field that you might want to pursue a DM for that matter of fact, be it medicine, be it surgery, be it pediatrics, the three most branches which are mostly opted by one. If you're doing if you're trying to pursue your MD in these subjects, a bond will be the biggest deterrent for your further growth as a doctor. You won't be able to go to another state to pursue an SR-ship. You won't be able to do a MCH. You won't be able to even prepare for an MCH, and you won't be able to break the bond because bond money is too high. With the bond, you're trapped. It stifles your growth. So remember, if you're planning to do your MD in a subject, medicine, peds, and surgery, the biggest thing that you need to consider, I'm not talking about other branches, I'm not talking about radio and derma. And if let's say you're someone from a city which has in a state which has a bond, but you want to stay in that city, so fair enough. You do your MD, you do your 1 year or 2 years of DM or SR-ship in that state itself, serve the bond, come back to that city. That's perfectly fine. You gain the 2 year experience that I'm talking about. In 3 years, you won't become good at that branch. You gain it in that same state, you come back and you practice and you flourish. That's perfectly fine. But if you're someone who's practicing for these particular three branches I'm talking about, medicine, peds, and your surgery, slightly less for peds, like I've told you, peds can be considered an end branch, but still for 50% of the cases or 30 to 40% of the cases, I'll say even for peds, bond is going to stifle your growth. There is no doubt about that. I've talked to multiple people, innumerable people, who have told me the biggest reason they were not able to pursue their choices or their career and had stepped back a year or two was because of the bond. And second thing, what happens is in states which have higher amount of bond, they also tend to have lower amount of salary. Now, people might just say that, salary doesn't matter and वैसे भी होने वाला है. But let's be very honest. We all are 24, 25 years of age when we are going to start our post-graduation. By the time we finish our post-graduation, we'll be 27, 28. And at that point of time, a lot of us are going to get married and a lot of us will have a lot of family responsibilities. And let's be very clear here. Money matters. I don't know why people don't believe that. Please, there were certain comments on my section. I'm probably being petty if I'm doing this right now, but I just wanted to highlight, don't be like this guy. someone who was telling me that I'm misguiding people about peripheral aims, I can very well vouch for the fact that AIMS Jodhpur, AIMS Bhubaneswar, and AIMS Rishikesh are really good institutes, especially because of the fact that they don't have any bond and because they have highest salary. And right now, their clinical exposure is good. Maybe this thing was valid, what he's saying, 5 years before in 2016 and 17 when they were growing, but right now, a lot of faculty there in these institutes are people who have passed out from AIMS Delhi itself. So I can personally vouch, I've myself gone to AIMS Jodhpur. I can personally vouch for the pediatrics department of AIMS Jodhpur, Rishikesh and Bhubaneswar. They're excellent, good department, and especially considering the fact that the bond and your stipend is good, they should be considered topmost priority. Don't be like this guy. He believes as if that everyone is has beggars don't become doctors, and everyone has a good financial background. Please don't be like him. Let's be very clear about our own financial understand about our own financial weaknesses and strengths if that somebody has that. Choose a thing which doesn't have any bond and good stipend. I will definitely agree with this person, whoever has posted this. The first thing should be no bond or less bond. A 1 year bond is not that much, you can consider. Second, which gives more stipend. And finally, academics should be there. Now, in my opinion, academics and stipend are almost on a similar level. Now, this can be a personal preference and this can be decided depending upon how you are yourself as a person. If you're someone who is dedicated and intelligent, who thinks he can study on himself. For example, I myself believe that I'm someone who, if is put in a place where there's no academics also, I'll be able to thrive because I love to study and I can study even at a place. But if you're someone who's not like that, in such a scenario, if someone who's dedicated and intelligent, if you know that you are someone who is in general a bit more dedicated as compared to your peers, in that scenario, I'll say choose pay more than academics, because you will be able to study on your own. You will be able to find and gather resources irrespective of whether the academics in your college is good or not. Versus if you are someone who believes that you're not as dedicated in such a scenario, and if you at the same point of time do feel that you have the resources to sustain yourself through the 3 years of post graduation, then only choose a college which has better academics as compared to pay. The reason I'm saying this is because a lot of us don't realize, but when you will get into post graduation, you realize that a lot of growth happens after post graduation. The actual learning and the experience tends to occur in the final year of post graduation and after when you start doing your SRship. The first year is literally spent in doing scut work, irrespective of the college where you are. Be it the best college in the country like AIMS, or be it in the worst college of the country, whichever you want to consider for that matter of fact. The first year of any residency will be doing scut work. You'll be doing just sampling, you'll be just doing roaming around with patients, you'll be just giving reports, you'll be just working up patients. There won't be any actual learning. And if anyone who tells you that in 2 years you can become an excellent doctor, please, I'm sorry, he's lying to you. He's making a fool out of you. You cannot become an excellent doctor in just 2 years. So obviously you need to supplant it with more experience that will be gotten in SRship. And in those 2 years, during your PG, when you will have some time to study, then it is dependent upon yourself. Whether you're someone who's dedicated, then prefer pay, because you can study on yourself. If you're not someone who's as dedicated, who's someone who feels is not as intelligent, then maybe choose a college which has more academics. So in my opinion, that's how you should go. First, choose a place where there is no bond. You are underestimating its importance, the importance of bond. You'll feel bonded. The word itself says bond. You will be like a bonded labor. You will be like a slave to that state. Please don't underestimate the importance of having a college which has no bond. Second will be academics and pay, depending upon your personal preference, depending upon your personal capabilities, depending upon someone. Suppose a lot of people a lot of people will be coming from places which do not have a good financial background. People won't be having good financial support. In such a scenario, it's absolutely fine if you choose a college which is slightly lesser in academics but has a better pay. Everyone has to take a decision for themselves. But these are the 3 things that everyone should keep in mind while deciding a college. Thank you.